There we go. Beautiful. So thank you all for joining on a little bit of short notice for this GFAN call, but welcome. We're here to talk about the G20 and get updates from our colleagues who are working on the C20, which is the Civil Society 20. If folks, there will be opportunity to ask questions. So if you have any questions, make sure to use the hand raise function, or you can pop your question into the chat, and we'll try to get to people within order, but we'll just wait till after everyone's kind of done their presentation before we get to questions. To start the call, I'm going to hand over the call to Stefania Burbo, who is the C20 chair and one of the coordinators of the C20 Global Health Working Group, and Rachel Ong, another co-chair of the group. They have a third co-chair, Kurt Frieder. Perhaps I pronounced that incorrectly. I apologize if I did, but I don't think he's on the call today. Stefania will start by briefly describing the C20 process and the work done by the working group, and then Rachel will present the priorities of the working group. Stefania, I will turn it over to you. Were the slides for your part or Rachel's?
No, I'm just saying few words, and then Rachel is showing the slides.
Okay, perfect. I will let you go ahead then.
Okay, thank you, Tara, and thanks to all participants for joining this call. And yes, as Tara has just said, I will briefly describe the Civil 20 process and the work done by the Global Health Working Group of the Civil 20 so far. So as probably some of you know, the Civil 20 is one of the engagement groups of the G20. The engagement groups are non-governmental platforms dialoguing with the G20 on the topics of the G20 agenda. And the Civil 20 provides a platform of civil society organizations and communities to bring forth the political dialogue, of course, with the G20. The Civil 20 process involves a wide variety of organizations, networks, communities, far beyond the G20 countries. This year, there are more than 560 organizations from around 100 countries joining the Civil 20. It is organized in thematic working groups, and one of them, of course, is the Global Health Working Group. It has also a steering committee leading the process, supported by an international advisory committee. As Tara has said, the Global Health Working Group this year has 3 coordinators, Rachel Ong, Kurt Frieder, who is on the call right now, and myself, and I've also been appointed as a Civil 20 chair this year. Now, with regard to the G20 topics, health has always been an important issue on the G20 agenda, but this year even more, of course. And as a Civil 20 Global Health Working Group, we have therefore been particularly active this year. We participated in the G20 Health Working Group consultations. We submitted our group recommendations ahead of every consultation. And we were also involved in the Global Health Summit preparatory process. We co-chaired the 3 sessions of the consultation with civil society organizations in April ahead of the Global Health Summit. Another activity was with the high-level independent panel established by the G20 this year to identify the gaps in the financing system for the global commons for pandemic prevention, preparedness and response. We submitted some recommendations and are going to submit a note to comment, to give feedbacks on the report that has been released by this panel in Venice in June. And the next key G20 events are the side event on the impact of COVID-19 on mental health on the 3rd of September, and we have already submitted as a Global Health Working Group some recommendations to the organizers. Then there will be the G20 Health Ministers meeting on the 5th and the 6th of September, and they will release a declaration. And then there will be the G20 Joint Finance and Health Ministers meeting at the end of October, just before the G20 Leaders Summit. I've been invited to participate in a dialogue session of the G20 Health Ministers meeting with non-governmental actors, and I suppose I will present our recommendations that are included in the C20 Policy Pack, the document that brings together the recommendations of all the C20 working groups, and that will be released in a few days. I will stop here. Rachel will present our recommendations, and then also together with Kurt, we will be happy to answer your questions. Thank you for your attention.
Great, thanks so much, everybody. My name is Rachel Ong. For those that are not, that I don't know, I do see quite a few new names in the participants list this time. My name is Rachel Ong. I'm the Regional Coordinator for Global Fund Advocates Network Asia Pacific, and I'm based in Singapore. So thank you so much, Stefania, for the introduction, as well as for colleagues that jumped right from the other call we just had to join this one. So apologies if you're going to be hearing something repetitive, but you should know them by heart by now, because those are the priorities from the Global Health Working Group. But before I begin, just to give a brief background to what the C20 Global Health Working Group is. We are made up of civil society communities across the world, and for this year's policy pack, we have actually introduced a chapeau that we have the overarching goal of achieving universal health coverage. And we advocate for health as a global public good and a human right, which is critical in achieving the Sustainable Development Goals. We are firmly committed to ensuring health, women and girls in all their diversity, vulnerable groups, marginalized communities, and key populations are at the center of global health strategies and responses. So for those that are working in HIV, TB, and malaria, please note that this is something very new that we have kind of forced into the health working groups agenda, which is the work around vulnerable groups and key populations, which is defined according to WHO's list for people who inject drugs, men who have sex with men, transgender people, sex workers, and people in prisons and other closed settings. So there are 4 priorities of the G20 Health Working Group this year, which is health and sustainable recovery, building transformative resilience, coordinated and collaborative response, accessible control tools. So I will go through the 8 recommendations that we have as the Global Health Working Group of the C20 that we would be including in the policy pack. Please do note that the recommendations in the policy pack come up to 6 pages in class size 10.5 font. So it's actually quite long. So you do have pretty summarized priorities here. So priority 1 would be ensuring that human rights-based, people-centered, equity-focused, and gender transformative responses are at the center of everything in addressing development issues. The second would be ensuring meaningful and inclusive participation of communities and civil society organizations at all levels of health governance. In the meeting we just had with the G20 Health Sherpa, we emphasized that this needs to be a bottom-up approach and not only in global processes. Next slide, please. The third one would be equitable access to healthcare. One of the key things that we've been pushing for would be ensuring that countries, especially the G20, support intellectual property rights TRIPS waiver for vaccines, diagnostics, treatment, and technology transfer. In short, COVID-19 commodities, and ensuring that there is full support and funding for Act A pillars and CTAP and other related mechanisms. One of the key things that we're pushing for is ensuring that we learn from the lessons of COVID-19 and translate them into action across all diseases to ensure that the equitable access is not just relevant to one pandemic. The next slide, please. So global health solidarity is another priority that we do have to have the leaders work together more closely in addressing also, which is the next point, a revitalized and reformed global health architecture. We do see the one that needs a strengthened WHO and one that promotes multi-sectoral action, subsidiarity, integration, equity, innovation, and human rights-based and gender transformative approaches. Next slide, please. Of course, health and community system strengthening and sustainable financing is also at the center of a lot of our conversations. And that needs to be done through increasing fiscal space, progressive taxation, debt cancellation, and ensuring that our leaders uphold, and the donors especially uphold their commitments of the 0.7% ODA per GNI target. This next slide, please. So One Health approach is something that is very high on the G20 agenda this year, which is ensuring that we're looking at more holistic global health systems, which consider environmental health, ecology and food systems, veterinary medicine, molecular biology, et cetera, et cetera, et cetera. This is something that we are looking at. And in the policy pack, you'll actually see that we make a very clear recommendation of ensuring that there are clearer guidelines and policies that will guide, for example, wildlife trade, that actually we suspect might have been one of the causations of the outbreak that we saw in Wuhan. The last but not least, digitalization of health systems and healthcare is something that is really high on the agenda as well, which includes actually looking at the widening disparities and gap of the digital divide, and ensuring that while we're addressing digitalization, that this is incorporated into health systems and healthcare so that we do get better data and more accurate data. So over to you, Tara.
Finding my unmute button again. Thank you very much, Rachel and Stefania. I really appreciate that. Does anyone have any questions for Rachel or Stefania? If you do, please pop something into the chat or use the hand raise function. I see Mick, you've got a question. Do you want to go ahead?
Yeah, thank you. I understand all the things that you're pushing for and the statements you've made. What I don't understand, and what I would like to question and hear from Stefania and Rachel is around key populations. When you say key populations have become an interest priority, but there is no mention of criminalization in any of the statements you've made, I don't see how you can even contemplate the concept of engaging with key populations unless you deal with criminalization. We're all criminalized populations. And unless G20 actually addresses the issue of criminalization of key populations, all the rest that follows is just fancy words that actually mean nothing. And the level of which those words are expressed are just at a level that most key populations, if not all key populations, cannot relate to. So my question really is, how are you relating all this to key populations? Thank you.
Thanks, Mick. Does anyone else have any questions or anything for Stefania and Rachel before I turn over? We'll just let Peter, can you please go ahead?
Yeah, this goes to Rachel and Stefania and Kurt as well. You know that I mentioned that I raised my question related to the G20 meeting and whether there is access to civil society in the media room, and there was no clear answer. So I ask you whether this is on your radar, because when we talk about civil society integration and participation, it's really important that we have access to the media room and to the information that is communicated there. So if you have any information, please go ahead. I don't know how I should judge the response of the ambassador. I thought it could have been an insult. I don't know. Maybe you find some words around that. Thank you.
Thank you, Peter. Why don't we let you guys take those two questions? And if anyone else has any questions, feel free to pop them in the chat or raise your hand.
Stefania, you want me to try and give it a go? Sure. So Mick, I think it's a very fair point. So we have not used the word criminalization specifically, but we have pushed in all our papers the words legal barriers and ensuring that we're upholding human rights. And human rights has always been in the forefront of all our key messages, that we need to approach all health interventions and policies in a human rights, people-centered, gender transformative way. I think not addressing that, not using that word specifically, we will make sure that we do try to incorporate that to make it more clear. But point very well taken. But we have not tried to gloss over and make it just a hot topic just by including key populations, but acknowledging the term key populations was very essential in the work that we've done this time round. So Stefania, maybe let you try and handle the one about processes for yeah, and maybe Kurt might have something to follow up on.
Yes, with regard to Peter's question, Peter, I think it's just too early to know. Of course, we have already paying attention to this issue. We have the experience of the G7, more than one G7 in Italy and also G8. So we know how much important is to have civil society at the media center. But really, it is just too early. And currently, considering how the pandemic is going on, we even don't know if the G20 summit leader will be virtual or not. Currently, they said that it should be in person, but we will wait. But of course, it is one of our priorities to see how to have this. This is our priority. I mean, we have been already in contact with the delegation at the Ministry of Foreign Affairs that is in charge of the logistics.
Thank you, Stefania and Rachel. Kurt, did you have anything you wanted to add?
No, not really, but I only was thinking the whole time about Mick's question about criminalization, and I wonder one thing. I'm not sure that we haven't mentioned in any of our statements. We have done quite a lot. We have had a lot of meetings and we have had a lot of presentations. But even if we forgot it, it was our fault. And then we may be able to correct it in the policy pack I think that we are presenting these days. I'm not sure, but we have to look to think about that, Stefania, because I think that Mick presented a very important issue. Thank you.
All right, thank you. I think, is there any further questions for either Stefania or Rachel or Kurt? If not, we'll move over to the the Secretariat, and I just have to get back my run of show to make sure I say everyone's name correctly.
While you're getting your run of show, maybe just to continue on Mick's question, because I just want to make sure that Mick's not happy or satisfied, but I did address the question, because I think what we have provided in the policy pack will actually be more specific, because there are we will specifically address the fact that there are barriers that have been faced by key and vulnerable populations in addressing COVID-19, and that has made even current health programs very neglected. So we, in the extended version, because this is a very summary of the top headline topics, that there are issues around being able to address current epidemics as HIV, TB, and malaria, ensuring that we ensure current health and systems and programs do not drop our key and vulnerable populations off the agenda. So there would be a more extensive elaboration of the key topics, but please do keep us on the toes after you've read that and you're still not happy with it.
Yeah, just very, very quickly, you know, politically, we know key populations are getting squeezed out, you know, with African governments, with other governments, key populations are getting squeezed out. And it includes the Global Fund and C19 RM, key populations are not receiving the recognition or the support that they should have if we want to be effective. And I think one of the issues is criminalization. It's not the only issue. It is one of the major issues. And if we don't try and force this onto the G20 agenda, then things are really not going to change that much. It's just going to be words. That's all. I'll stop there, because, you know, certainly Rachel knows what I feel, and so does Stefania. So.
Thank you. Musa, I'm hoping I'm pronouncing your name correctly. Did you have a question for Stefania and Rachel?
Yes, thank you very much, and thank you for leading on this process. Looking at the webinar, you know, also looking at serving as opportunity for G20 Health Working Group to share, you know, priorities going forward. I want to share this more specifically, you know, how some of those global decisions are also maybe trickling at the level of access, you know, especially for countries in the global south. And I'm happy someone asked questions around, you know, how we have equally seen government criminalizing vaccine access, you know, so Sierra Leone is of no exception where I'm working, where we have noted, for example, that government is using vaccine access as a priority. And for people who choose to not access the vaccine or not to go for vaccination, it seems to be kind of criminalized to not access public spaces, public offices, as the case may be. How can we as GFAN, for example, start looking at some of those rights violations and some of the intricacies around policy, to be able to also strike the balance between policy and practice, especially when it's about safeguarding and protecting the rights of citizens generally?
Thank you very much for that question. Sorry, there's too much going on in the background. Rachel or Stefania, is there
So if I understood the question, because it was a really long paragraph, we did have a discussion in the last call, the importance of vaccine literacy and I know the question isn't necessarily around vaccine literacy, but it's also ensuring that there is absorption for, sorry, I'm hearing a lot of. Great, I'll unmute myself. So it's about ensuring that there are efforts to ensure that there's better absorption of countries that actually do have vaccines sitting in the warehouse, which might be expiring. The other approach is understanding that there will inevitably be a carrot and stick approach. I don't think that any countries have made it a crime to actually not get vaccinated or to get vaccinated, to not let yourself be vaccinated, but they are approaching allowing, they are introducing different policies or carrots to get people to go and vaccinate themselves. So it seems to be something that G20 is not openly discussing, because that would be the sovereignty of each country. But there have been, for example, Japan has been pushing for the G20 to actually have a conversation around what international travel policies would look like in terms of the COVID-19 and the vaccine passport. So it is on the radar, but we haven't heard more specifically from the G20 countries. Stefania or Kurt, do you want to?
Yeah, I would like to add to that actually before many countries started with politically driven health interests and concerning vaccines, we heard a lot of times the richest countries that they were going to share their vaccines through COVAX or whatever, but they would share the vaccines with the world. And now we are finding out that the world continues to be unequal as it was ever before, and something that we know. Unfortunately, we find ourselves in a position where in some richer countries you have a lot of vaccine hesitancy, and in the other countries you have a lot of people that are not getting the vaccine that they long for. And that is a big issue that should be considered, but it requires probably a longer meeting or something that we could do as an advocacy work everywhere, no? And that we should do as an advocacy work everywhere, because this is going to be the big problem really in the future. Thank you.
Thank you, everyone. We're going to have to switch over and go to our friends at the Global Fund Secretariat. Sorry if my dog starts barking. My husband just left, and this is the first time everyone's left the house today, and she forgot that I was here and had a little panic attack. And so I've been trying to keep her quiet because she just realized I was actually home. But so apologies if she starts barking while I'm talking. But okay. I do.
Dogs are welcome. Dogs are welcome.
Okay, good. I do want to now welcome Charlotte Dees and Laura Rabelski. I'm hoping I got that somewhat close. Both from Donor Relations, who are working on the G20 process for the Global Fund. I understand that they have slides and they're going to share the screen from their end. But let me know if you need anything. But I will turn it over to both of you.
Thank you, Tara, and hi everyone. So I'm happy to take you through the few slides that we have, and I'm sure Laura can complement anytime and maybe in the Q&A as well. Support me. So maybe Tara, are you projecting, or are you able to show the slides that I sent you, or should I?
You sent me a PDF of the slides, so yeah. I'm happy to share them. It'll just take me 1 second to get them up.
Wonderful, thank you so much. That would be helpful.
Of course, it'll just take me 1 minute. Sorry, I assumed when you sent the PDF that you were going to share on your end, but that was a mistake on my part. Hold on 1 second.
Sure, no problem.
Because now I can't find your email. I'm having a day, apparently. Apologies. I even flagged. There it is. 2 seconds. Apologies, everyone. This is how it, and then share screen and share. There, I hope that works for everyone.
Yes.
Perfect. I will.
At least on my end.
There. Good.
Super, thank you. Thank you so much, Tara. So maybe to save everybody's time, Stefania, you mentioned the key dates of the process this year, but maybe visually it can be helpful to look at here, and maybe starting by by the summer. So you mentioned indeed the finance track and the high-level panel recommendations, which were shared at the finance ministers meeting in July. And then, of course, we are now working towards the health ministerial very early September. And so we are in the second iteration of the draft declaration at the moment. And then you also mentioned, Stefania, this process leading to the joint health and finance ministerial at the end of October, just preceding the Leaders Summit. So just mapping out these few dates might be helpful. And also Laura is working very closely with Italy on the Global Fund anniversary event at UNGA in September. So it's now confirmed. The exact details are not yet confirmed, but we're very pleased to have an event with the G20 to celebrate the 20th anniversary of the Global Fund, and that's a very good thing to have. So maybe moving to the next slide, and that's a recap on the priorities of the Italian presidency, and I know most of you are already aware that the agenda was focusing on the 3 Ps, people, planet, and prosperity, and in particular from the health perspective on the impact of COVID-19 on the SDG agenda, and in particular SDG 3, but also other dimensions and other SDGs. And also they were focusing, so the health working group of the G20 was focusing also on equitable access to diagnostics, treatments, and vaccines, what they call pandemic tools, and the One Health approach as well as one of the key priorities for the Italian presidency. And obviously, we just mentioned in the finance track as well, everything around the pandemic preparedness and response, and in particular financing mechanisms to provide more sustainable financing of these dimensions. Next slides, please. In terms of the Global Fund Secretariat engagement in the G20 process, so as you may know, since 2019, the Global Fund is a member of the G20 Health Working Group. So we are we have the privilege to participate in each meeting of the Health Working Group and to be able to also input in the outcome documents and also in the Health Ministerial Declaration that is at the drafting stage at this point. In addition to that, in July, we've been invited by the Italian presidency to join what they call the Health and Finance Informal Group, which actually will be preparing the outcome document and the communique for the joint health and finance ministerial to be held at the end of October. So that's a very new and starting process. We have received sort of timelines, and we expect to be involved in the discussions and whatever consultation process that they put in place. So within that, of course, they will review the high-level panel recommendations. And as you may know, in that report, the role of the Global Fund was recognized in pandemic preparedness based on, of course, our huge investments in the field of strengthening health systems. And of course, supporting the countries, the low and middle income countries in the COVID-19 response. So in that context, also will be engaging in this consultation. And maybe, I mean, just sort of looking ahead, it's not for now, but it's coming soon. We are also engaging, starting to engage, really, it's very incipient with Indonesia as the next G20 chair. So we are already trying to establish a dialogue with our counterparts there. Next slide, please. So that's in terms of the advocacy messages for the G20 process this year. You can see here these priorities being mapped, and maybe I can go one by one. So basically, I mean, of course, one of our key messages and advocacy position in this presidency is, of course, to highlight the role of the Global Fund in the fight against pandemics, and also highlighting the role of the Global Fund as an effective vehicle to channel any investments to respond and prepare for infectious diseases in low and middle income countries. So basically, I mean, this is a key point of our advocacy, obviously, and one aspect of this is also to highlight the role of the Global Fund in making significant investments in the building block of what is the response to COVID-19 in many countries, including the lab infrastructure, the diagnostic capacity, of course, the disease surveillance and the community-based responses to HIV, TB, and malaria. So really highlighting all of these investments and how they are enabling countries to respond to the current crisis is at the center of this particular position. And so as the second main message is really pushing for, and I'm sure you've heard Peter on this and read many of the op-eds that is put forward this year in particular, is pushing for an integrated approach to pandemic preparedness and response that includes current pandemics, so HIV, TB, and malaria, and future pandemics. Because of course we cannot think of COVID-19 without thinking of all the infectious diseases that are affecting countries, and also the knock-on impact that COVID is having on the three diseases and vice versa. So it's really having this comprehensive approach to pandemic preparedness and response is very key to our engagement in the G20 process. Then in terms of the discussion around the impact of COVID-19 on the SDGs, in particular SDG 3, and building back better in terms of the economic recovery, we are really pushing for having a comprehensive a comprehensive concept of global health security in the sense that the investments made for AIDS, TB, and malaria are really the backbone of the current response to COVID-19, and any future investment should be linked to the current threats that countries have to face. And so that's also one important position here and key message. Then obviously, and as mentioned by all of you, and at the core of the C20 engagement is to highlight the importance of community engagement and gender and human rights principle for any global health investment, and especially make sure that PPR, pandemic preparedness and response, needs to be very broadly defined, not only encompassing current pandemics and future threats, but also as protecting everyone everywhere against the spread of infectious diseases. And having a concept of PPR that is really based on global solidarity and on equitable access to prevention, detection, treatment, and care. And making sure, of course, that CSOs and communities are fully engaged to safeguard these principles. So equitable access, indeed, as the number 5 message, key message that you can see on the screen is key, and also highlighting really the major role that the Global Fund has played in the fight against AIDS, TB, and malaria in this field, also in scaling up access to new tools, to new technology and innovative drugs, so that's also a way to really highlight the work of the Global Fund and how we can build on this good work for future responses, for current and future responses. Then in the current context, we are also making sure that the Global Fund is seen as a key actor, working together in complementarity with other global health actors on pandemic preparedness and response. So we've been, of course, as you know, one of the co-founders of the ACT Accelerator and very active in the different pillars. So really also pushing and highlighting the role of the Global Fund in rolling out the COVID tool and making sure there is equitable access to low and middle income countries. And also highlighting the important role that the Global Fund plays also in the fight against AMR, in particular with TB, but also with resistance, drug and insecticide resistance for malaria. And finally, we are, of course, leveraging this year to highlight the results achieved by the Global Fund Partnership in the last 20 years. With our 20th anniversary campaign starting this year, and really making sure that we also push and made known the country ownership and governance model of the Global Fund with civil society and communities participation and human rights at the center. So that's also a very key consideration that we have for our campaign in G20 engagement this year. Next slide, please. Yeah, actually, the next couple of slides are summarizing. We thought it would be useful to share with everyone. I mean, in 3 slides, sometimes visually it's actually helpful. What are the references that we've achieved, the references to the Global Fund that we have achieved in the past G20 declarations, as an example, and as, of course, very good collective achievements, and also the references to the Global Fund that we could have reflected in the G7 declarations. So I was just mentioning before that we are in the stage of reviewing the draft for the ministerial declaration, the health ministerial declaration, for early September. And actually, so at the moment, the Global Fund has a good reference in the current draft. So that's very positive. But what is lacking still is a strong reference to AIDS, TB, and malaria. So we have to put some attention on this and bring back the reference to the 3 diseases at the center of the health declaration. So that's the end for me, and I'm very open to questions. And please, Laura, raise your hand if you would like to comment on any of these points. Thank you so much.
Thank you so much. Laura, did you have anything you wanted to add?
I think Charlotte covered everything very well. Happy to answer questions if useful.
Perfect. Thank you so much. Thank you very much, Charlotte. I appreciate that presentation. And as I put in the chat, all of the slides that were shared today will be available with the call recording. So you don't have to frantically take notes. I see one hand raised already from Mick. If anyone else has any other questions, please feel free to raise your hand or pop them into the chat. But Mick, I'm happy to hand it over to you to start off this round of questions as well.
Thank you. Let me just put my hand down. Okay. Yeah, thank you for the presentation. I have a couple of sort of points. The Global Fund must be clear, according to the Global Fund Board, that their response to COVID is only in terms of improving the response to HIV, TB, and malaria. It's not a standalone. That has to be clear in the discussion and the presentation that the Global Fund makes to G20. Secondly, the Global Fund doesn't have a very good record with key populations and communities in terms of COVID or in terms of their general grants, but they have made a big effort in the C19 RM2, I think it is, but that is not sustainable. The effort to include communities and key populations, the effort it took to engage in those issues, in the C19 RM issues, are not sustainable. So I think it's important that the Global Fund makes a statement that a broader involvement of key populations and communities in health response is important. And we won't make the progress that we all want to make unless that happens. And so my question, I suppose, is, are you going to make that kind of strong statement? Thank you.
Thanks, Mick. James, I see your hand raised.
Thanks, Tara, and apologies for my weird looking background, having some housework done at the time. So it's not a more normal setting. Thanks a lot for the presentation. Looking back at some of the previous declarations that you shared in some of the slides, saw some of them made referencing to resourcing of the Global Fund as well. So I wanted to check in what you think the feasibility is currently for a reference to the seventh replenishment in either the health ministers or the main political declaration later on. And obviously it was a shame to not see a reference to the 3 diseases in the G7 leaders communique. So it would be great, obviously, to try and avoid that for this time. So I wonder if you could say a bit more about a lack of reference to the 3 diseases in the current declaration, and if there's any particular G20 countries that are opposed to this, and if you had any advice for us as advocates for where we should put our attention and do anything differently to some of the limitations for what we're able to get for the G7.
Thanks, James. Does anyone else have any other questions before I turn it over to Charlotte and Laura? I don't see any popping up in the chat or any hands raised. So Charlotte, Laura, why don't I turn it over to you, and perhaps there'll be more questions following.
Sure, and I don't know, Laura, if you want to address particularly one of these questions. Otherwise, I can just give it a go. Up to you.
As you like. I'm happy to start. And thank you so much for all your questions. And some of them are not easy, as we are in difficult situations. Are we all know. So let's start with the first one, and the fact that, of course, the Global Fund is working on 3 diseases and try to limit the impact that COVID is having on the 3 diseases. This is exactly how our work in the COVID response has been framed. And this is how it's presented. Of course, as you know, we work in ACTAE, and ACTAE is international response to COVID. So from time to time, we are linked to that as well, because we are one of the different actors working on ACTAE that is mainly on the COVID response. But what the Global Fund does is of course mitigating the impact on the 3 diseases. And you're right in saying that there are some lively discussion at the board. But at the same time, I have to say that the role that the Global Fund can play in a situation like that is also recognized, and this is what we are doing. So I personally think that what we are trying to say in the context of the G20 and the G7 for that matter is very much in line with what the board is asking us to do. But at the same time, we know that the situation is fluid and quite complicated. On the other point that you mentioned, that is a very important one on key population and communities, I have to say that the Global Fund has been the only actor in the health working group really trying to put reference to communities, and no one else, countries or international organization, were trying to do the same. I'm not sure we have been as successful as we wish, but you can count on the fact that we will try to make sure that the references are there. Of course, we are one voice, and there are many things that we're trying to push, for instance, the reference to the 3 diseases. And especially this year, considering the context of COVID, there are so many actors, interests, and different ways to see what needs to be mentioned in a document that will not be too long, that it's quite tough. But I can reassure you that communities are really what we are trying to push, and not many others are doing the same, I would say. And then, of course, Charlotte, you can add, just to cover the last question on the 7th replenishment. Our aim would be to have the 7th replenishment mentioned next year. This year we focused on the 20th anniversary. And the idea was really to recognize what the Global Fund partnership has achieved in the last 20 years. And then to leave the mention of the resource mobilization itself for next year closer to the replenishment conference itself. Charlotte, I don't know if I covered all the questions. I'm sure that you can add other elements.
Thank you, Laura. That's great. Yeah, I mean, really seconding what you were saying on the role of community responses. This language is there, and definitely we've been proposing this language so many times. So yes, we are definitely pushing for that. That's for sure. In terms of the absence of the full mention of AIDS, TB, and malaria, it was in the first version and disappeared from a second version. So we're going to advocate for its inclusion. As you know, the priorities of the Italian presidency has been strongly focusing on One Health, on nutrition, NCDs are there, and also on mental health. So all of this is there, but indeed, this is absolutely key to have a full mention of AIDS, TB, and malaria. TB is mentioned under the AMR paragraph, and so yeah, I think any support and probably the C20 colleagues who are also on the call would strongly advocate for that. So I think we'll manage to get that. But anyway, it's yeah, there are a lot of competing priorities by the Italian presidency, I guess, this year. Over.
Thank you very much, both. Are there any follow-up questions? Mick, I can see you gesturing.
Sorry, I mean, I accept all the points that has just been, Charlotte's just made, but the point is, it's what the Global Fund are going to do. It doesn't matter about all the other agendas. Yes, I know there's politics involved. I understand that. But the Global Fund needs to be clear that its COVID response is in support of the mitigating the impact on HIV, TB, and malaria. And if it doesn't do that, it's not in line with the board directives, and it actually impedes the global response because everybody has their role. And it's frustrating to hear you try and justify a broadening of the Global Fund response because of other agendas, when the Global Fund response is clear and has been clearly directed by the Global Fund Board. And just to let you know, I am a member of the Communities Delegation, so I am party to the Global Fund Board debates. Thank you.
Yeah, Tara, if I can just clarify what I was trying to say. We were talking specifically on the declarations. And in the declarations, there are some mention to ACTE, and the Global Fund is part of ACTE. And this is where there is a strong link with the COVID response. And this is what I was trying to say in relation specifically on the documents that may come out from ministerial meetings. Then on the COVID response of the Global Fund, this is of course in line with what the Global Fund Board has decided, and this is what the Global Fund does. So I was just trying to explain why we are also linked to the COVID response, the pure COVID response, if you want, because we are part of ACTE in that sense. But I don't know if this is not helpful in clarifying the outcome of what we could potentially see in the end documents of the ministerial meeting, then maybe it's not relevant. But that was my only point.
Thanks, Laura. Thanks, Mick. I don't see any other hands raised or any other questions. But I might steal this last minute before everyone disappears to just remind folks that we are looking for members for our international steering committee. So if you want to help support GFAN and help GFAN function and be the best GFAN it can be, we should definitely consider applying to be a member of our steering committee. The applications are due at the end of the month, so please have a look. I put the link in the chat, and I see that there is a hand up. Perhaps, is that Linda?
Thanks,
Pauline.
Tara. Yes, it's Linda, and I think Pauline as well.
Okay.
Thank you so much, and it's really great to hear all the activities and the plans for the C20 and the G20. Just to reinforce what was said by the team, but also recognizing what Mick has really emphasized as well. Definitely, we are taking the message back to the Secretariat. We're taking the message back to the strategy team that is developing and working on the strategy, but also we are taking the message back to the Secretariat leadership as well, because what you are saying that our core business is HIV, TB, and malaria, and we're working on the pandemics to mitigate the risk in terms of potentially forcing us to regress from what we have achieved already in terms of HIV, TB, and malaria, but also having key population and communities at the center. So that's the key message that we will again take it back to the Secretariat, but also take it back to the Global Fund family. So I just wanted to reinforce that, because that is quite important in terms of taking it to the Secretariat as well. Pauline, over to you.
Yeah, and in addition to that, I also wanted to acknowledge and and thank the great work of our civil society colleagues who are engaged, who have been engaged on the C20 since a few years. And there was some exchange in the chat, recognizing all the effort and the progress that has been done. And frankly, if we look back, I think the first time, they were like really engaged as Global Fund Civil Society Advocate was in 2018 under the leadership of Kurt in the G20 in Argentina. Then there was a big accelerator that was done in Japan under the leadership of Masaki, a Japanese colleague, and a group also of civil society colleagues who were involved, particularly in that, at that time, there were in-person C20 meetings. And then, these efforts being continued through Saudi Arabia, leadership, and now in Italy, and continuing towards Indonesia, and also Rachel, who has joined the civil society health working group together with Stefania and the team. So really, I think when we look back in terms of global fund advocacy, this is one of the area where we've been really big progress and over the past years. And when we look at where we stand in terms of representation, the C20 advocacy is really a landmark of where we are really, really well positioned. So just wanted to say a big thank you. I mean, it is also highly recognized, within our senior leadership at Global Fund Secretariat. So I really wanted to congratulate you and to thank you for really the great work that you're all doing. Looking forward to the continuation this year and the next years, and also looking how we can also reinforce. And I'm looking at Peter here also for next year for the G7 as well. With the C7, I mean, we've been quite well represented for the C7, but maybe we need to really reinforce that for next year. I think we're in good hands in Germany. But really looking forward to continue on C7 and C20 with you all. So yeah, Katja and Sergius as well. It's just that I see Peter on the screen. So yeah, talk to you soon. We're over time. Thank you.
Pauline and Linda, and thank you everyone on the call today who participated. I really much appreciate it. I hope everyone has a lovely rest of their day, and thank you for hanging on for an extra couple of minutes. I'll get the call recording and the slides up later today or first thing tomorrow morning, my morning, your whatever. Have a great rest of your day, and we'll talk again soon. Bye.
Bye-bye.